Hello. Is anybody there? Hello. Am I audible? Am I audible? Please respond. Hello, guys. Am I audible? Please respond. Hello, Neetu. Am I audible? Okay. Fine. I changed my connection, so somehow I had to end my stream, but I think most of the participants have gone. Okay. Hi, Neelam. Okay. What do you think? Should we carry on or we'll do it some other time? Then maybe I'll. Hello. In case of certain lung diseases, a specific infected bronchopulmonary segment is surgically removed. So, how does the normal lung volume get affected by this? Yeah, obviously, the lung volume is going to decrease and pulmonary resistance will increase because those vessels are vasoconstricted, isn't it? Those vessels will not be there. So, there is increase in the resistance, but obviously it is required. And what about compliance in this case? There is something known as a specific compliance, right? So when lung volume decreases, we have to calculate the specific compliance. So okay, Neelam, some more questions. Fine, we'll handle it. So lung volume is definitely going to decrease. However, the compliance is said to be normal. Is it okay, Shreya? Neelam, go ahead with your questions. Yeah, there is, that's what, Shreya. Compliance is, as you are, it's a very good question. Compliance is delta V by delta P, right? So even though delta V has decreased, in that case it's correct. Delta V has decreased and delta P is normal. So compliance should decrease. But what we are telling that whenever the lung volume as such decreases, total lung volume because maybe of the size of the lung or the size of the lung or some bronchopulmonary segment has gone, you see the compliance of the remaining lung is same. There is some other problem. The lung volume as such has decreased, isn't it? So we calculate something known as specific compliance. So I'll give you an example. Suppose in a child, suppose in a child, the normal lung volume is less itself because the volume of the lungs as such is less, or any person with only one lung, right? So the transpulmonary pressure is same, and the volume of that particular lung is expanding normally. There is no problem in expansion as such, right? So that is why we in these conditions, when actually there is a decrease in the tissue, lung tissue itself, like in one lung, or in case of this children, we calculate a specific compliance. So similarly, in this case, when actually bronchopulmonary segment itself is removed, then we calculate a specific compliance. Yeah, Neetu, sorry, classification of hypoxia I was talking, and we are talking about oxygen therapy. So one is we have spoken about hypoxia, where partial pressure of oxygen in blood is decreasing, and we spoke about some causes of it, and in those causes whether oxygen therapy will be useful. Then second thing is we are talking about hemoglobin decrease, right? So that is known as anemic hypoxia. So in that case, not much help will be there with the increase in the partial pressure, because only the dissolved oxygen is going to decrease. But you know that majority of oxygen in blood is carried by hemoglobin, isn't it? So that is known as anemic hypoxia, and oxygen therapy will not be of much use. Then third is what? Stagnant hypoxia. Stagnant hypoxia is when so oxygen has entered into the blood, oxygen is combined with hemoglobin, fine, but it should go to various tissues. So if blood is not moving properly, right? So that is known as stagnant. Stagnant means paused, right? It is not moving. That we call as stagnant. So when does it occur? How does blood move? Blood moves because of the contraction of the heart. So if heart is not contracting properly, like in cardiac failure, there is a stagnant hypoxia, right? So in that cases also, the oxygen therapy will be of no use, of course, because how much ever oxygen you are providing, it is not going to go to the tissue, since blood is not moving properly. So you have to treat the cause in such cases. So that is known as stagnant hypoxia. And finally, it is histotoxic hypoxia, where tissue is not using oxygen. Again, if tissue is not using oxygen, you keep on providing oxygen therapy, how will that be useful? So you have to treat the cause for that. Obviously, if you say that minimal, very minimal beneficial it will be, yeah, it will be very minimal benefit it will cause. Okay, in anemic hypoxia, just a tidbit I want to add here. In anemic hypoxia, there are two things. One, where hemoglobin is decreasing, then it is not much of use. Basically, what is happening? The combination of oxygen with the hemoglobin is affected, right? Because the hemoglobin is less. But there is a second cause, that is carbon monoxide poisoning. In that, what is happening? Carbon monoxide is combining with hemoglobin. So what is affected? Actually, same thing is affected, combination of oxygen with the hemoglobin, because all the places of hemoglobin is occupied by carbon monoxide. So in this kind of anemic hypoxia, where carbon monoxide has combined, oxygen therapy will be useful, hyperbaric oxygen therapy. So we are giving too much oxygen, we are pumping oxygen, so that oxygen fights with carbon monoxide to replace it from hemoglobin, right? So when partial pressure of oxygen in blood increases, it can replace carbon monoxide from the hemoglobin. So in anemic hypoxia, due to hemoglobin deficiency, oxygen therapy will not be useful, but that due to carbon monoxide poisoning, oxygen therapy will be useful. Okay, so Neetu, is it okay? I covered classification of hypoxia, but one important thing from my side I will add there, that in which type of hypoxia, this question I keep on asking, but I don't get the answer from students. In which type of hypoxia cyanosis can occur? Cyanosis is bluish discoloration. In which type of hypoxia cyanosis will occur? Can anybody answer that for me? All type of hypoxia are dangerous if untreated. Okay. Hypoxia, yeah. So see, when we are talking about cyanosis, you have to think about when there will be deoxygenated hemoglobin accumulation. Deoxygenated hemoglobin accumulation, that we are talking about cyanosis. You have to think of that word. Where there is accumulation of deoxygenated hemoglobin, cyanosis will occur. So in hypoxia, hemoglobin is not getting saturated with oxygen, isn't it? Hemoglobin is not getting saturated with oxygen, so that hemoglobin. So hypoxia will cause cyanosis. Will anemic hypoxia cause cyanosis? Anemic hypoxia, whatever hemoglobin is there, it is getting saturated, right? Actually, hemoglobin is less. In anemic hypoxia, whatever hemoglobin is there, it is getting saturated, right? But overall quantity of oxygen is less. So, but it is not accumulation of deoxygenated hemoglobin. So, hypoxia, cyanosis present. Anemic hypoxia, cyanosis not present. Third, stagnant hypoxia. Blood is not going to the tissues. So, suppose here blood is not coming. Whatever little blood is going, these tissues will extract more and more oxygen from hemoglobin. Okay, so whatever is available, they will extract everything. So there is accumulation of deoxygenated hemoglobin in the periphery. What is that? Cyanosis, right? So hypoxic hypoxia and stagnant hypoxia cause cyanosis. But if you see ischemic hypoxia, no cyanosis. Fourth one, sorry, histotoxic hypoxia, will there be cyanosis? They are not utilizing, tissues are not utilizing oxygen. So obviously, the blood which is running through veins also, it is oxygenated only, right? It is not deoxygenated. So there is no hypoxia. Okay. So two types of hypoxia, there will be cyanosis. Two types of hypoxia, no cyanosis. Okay. So why I am telling you this, that by looking at the condition of the patient, by looking at whether cyanosis is present or not, you can actually find out which type of hypoxia it is. Okay. Fine. Okay, I think how nemotoxic center limit the duration of inspiration. It will inhibit nemotoxic center will inhibit apneustic center. If it inhibits apneustic center, since apneustic center is increasing inspiration, so that will cause inhibition of the inspiration. So it is limiting the duration of the inspiration. So that is nemotoxic center. Okay. I think it's 2. The time was 1 to 2. I'm sorry for the disturbance which it created in between, but I hope that I was able to answer some of your questions. How nemotoxic center increases respiratory rate? Simple. If it is decreasing the duration of inspiration, see, if inspiration is deep, it will take longer. So in 1 minute, less breaths will occur. But increases respiratory, if it is shorter, so in 1 minute, more breaths will occur. So that is how it increases the respiratory rate. Okay. I think I'll thanks all of my participants. The most of have left because of the previous trouble, but I'm so thankful for your active participation, and I'm hopeful that I was able to answer your questions. And please go to that community forum which I had given for this particular live session. Put your feedback of the session, put your suggestions for the session, what you want. Maybe I think if it was successful, we'll make another session also, question answer session, or maybe another system, or whichever system you want. Mary's law, are you talking about cardiovascular system now? Is that Mary's law you are referring? Pulmonary edema is nothing. It is accumulation of fluid in the alveoli and interstitium. So there is alveoli, there is blood. There is interstitial tissue and alveoli. So in interstitial tissue, blood accumulates. Pulmonary edema, so interstitial tissue and alveoli fluid accumulates. So if that happens, what is going to happen? See, the diffusion membrane, oxygen has to cross through the membrane. The thickness is increasing. So diffusion will be affected. Okay. So that is pulmonary edema. Mary's law. We'll go into cardiovascular system. Again, it is very deep. Mary's law, okay, in brief, I'll tell. Mary's law talks about how blood pressure affects heart rate. Okay, not how heart rate affects blood pressure. So what it says is, if blood pressure is more, heart rate is going to decrease. If you see otherwise, actually increase in the cardiac output increases blood pressure. So if you say increase in heart rate will increase blood pressure, yes, because increase in heart rate will increase cardiac output, which will increase the blood pressure. But Mary's law talks about how blood pressure affects heart rate. So it is a feedback, baroreflex, which is operating. That is Mary's effect. Increase in blood pressure, information goes to nucleus tractus solitarius, sympathetic, parasympathetic system effects, and causes decrease in the heart rate. So that is a feedback. It talks Mary's law. Okay. Uh, So increase in blood pressure decreases heart rate. They are inversely proportional. But if you see the other way around, that is the question they ask you. Is it true other way around also? It's not true other way around. Increase in heart rate actually causes increase in blood pressure if increase in cardiac output is occurring. So because if a heart rate increases too much, above 200 and all, then cardiac output doesn't increase after that. Then BP will not increase. Up to a certain limit, if heart rate increases, BP increases. So Rishit Verma, Gopati Rishit Verma, am I clear on that? Cerebral edema, that I'm not going to deal with here. But again, it is about some laws and pulmonary, that vasoconstriction. Hyperbaric oxygen therapy is almost same thing which I have told about. So instead of 760 millimeter mercury, if oxygen cylinders is a compressed, right? Compressed oxygen which we use, which is at higher pressure. So we at sea level, the atmospheric pressure is not 760 millimeter mercury. We are going to increase it to maybe 1000 millimeter mercury, and then we are taking suppose 100% oxygen. So what will be the partial pressure of oxygen? In that case, it will be 100% of 1000 millimeter mercury, right? So that is hyperbaric. That means we are increasing the pressure, atmospheric pressure itself. So when we are suppose at high altitude, if pressure is very less, then even when you are giving 100% oxygen, it may not be enough. So in that case, hyperbaric oxygen therapy may be given. Okay, so the whole atmospheric pressure is increased. So anyways, we are giving via external atmosphere, so that it will not be 760 millimeter mercury, or maybe at high altitude, say suppose it becomes 600 or maybe 500 millimeter mercury. Then the cylinders which we are using, actual pressure there is more than that. The generator is given for less duration because it increases the yeah, it's given for less duration because it increases the uh, partial pressure of oxygen too much. And as I told you earlier, like in deep sea, we were thinking it will cause the generation of the radicals, oxygen radicals. So that's why it is a bit dangerous, hyperbaric oxygen therapy. Thank you, Rags BD, for a compliment. One of the best teachers on YouTube. Thank you so much. I just hope that people understand the subject and just not mug up, because physiology is so central to understanding of medicine. Chain Stokes breathing. Neetu, can I answer it in my community post if you don't mind? Because it's 2 o'clock and I'm sorry, I cannot extend the session. CVS and CNS as well. Okay, I'll keep a session for CVS. CNS for sensory physiology, I have made a video, and after a video on, I think, what was the topic which I thought? Yeah, acid base balance. Sorry. After videos on acid base balance, we'll move to motor system and special sensors for CNS videos, Shreya. Cardiovascular, I will keep a session as you have suggested, maybe after 15 days. Okay. Okay, thank you everyone for your active participation. I really enjoyed this session, question answer session. It was a very quick answers, and hopefully I was able to give you. Please go give your feedback on the community post on the YouTube channel. Thank you. Bye. Yeah, I'll definitely save this video, and I hope the last one is saved because I just joined another one. Okay, thank you. Bye. I'll upload the previous video, little bit editing I will do so that it is only question answers which I'm handling. Okay, fine. Thank you. Bye. Bye.